are live, Judge. Do we want to have Melanie do a roll call?
Sure, that'd be great.
Okay. Judge Anderson.
Here.
Okay. Pam Bills.
Here.
Kristen Branham. Dr. Brown. Judge Cowan.
Here.
Okay. Judge Craig.
Here.
Okay. Judge Dial. Not yet. Okay. Dr. Falazadeh won't be here tonight. Judge Frank. Okay. Gina Good. Judge Green.
Here.
Patty Gwynn.
Here.
Matt Jackson. Okay. Dr. Jasper.
Dr. Jasper is here. I see him in.
Yeah, I have him marked as here. Judge Kelly, I know you're here. Kay King.
Here.
Terry Lawson.
Here.
Okay. Dr. Lee.
Here.
Dr. McKinley. Dr. Miles.
Here.
Dr. McKinley's here. My thing wouldn't unmute.
Okay. Dr. Perkins. Okay. Judge Phelps.
I saw Judge.
I am here. I'm here.
Okay.
I had to unmute. I get everything set up here.
Dr. Phillips.
Here.
Okay. Dr. Rexroth.
Here.
Okay. Dr. Richardson. Okay. Judge Robertson. I see you. Okay. Joe Silvers.
Here.
Okay. Judge Smith. Jake Staten. Okay. Jim Wesley.
Jim is here. He texted me and said to count him as here. I see him.
We have 19 officially.
All right. Well, that's enough for a quorum. So that's good news, Judge. We're official. You can call it to order.
All right. Well, I'll welcome you all here to our district board meeting. And as is customary, we like to open with an invocation. And if he didn't mind me putting him on the spot, I'd like to ask Judge Anderson if he'd open us up in word of prayer this evening.
Okay, let's pray. Dear God in heaven, we truly thank you, Lord, for this day. Judge Craig was talking about the sunshine and good weather to come, God. And well, we know, God, that you're the creator of all things. And we know, God, that you're in control. We've had a tough 2 or 3 weeks here in this district and around the state. And we just pray, God, that you continue to put an umbrella around us and over us and protect us, Lord, from evil. We give all thanks tonight to Jesus Christ, our Lord and Savior. We're thankful for the blood that he shed for our sins. And we're thankful that there will be another day as you arose from that grave. And we're thankful for that. We just pray, God, that you preside over this meeting, be it Judge Kelly this evening, be with Sean, Mr. Crabtree, and so forth. And we just pray, God, that the numbers continue to drop as we look each day. And we're thankful for the vaccine. And we just pray, God, that you continue to lead and guide and direct us to do all the things, Lord, that you wish us to do. And this I pray in Jesus' precious name. Amen.
Amen. Thank you, Judge. All right. Well, we'll call this meeting to order. The first item on the agenda then will be approval of our minutes from our previous meeting. And You all were sent a copy of those. Are there any changes or deletions we need to make there? If not, we would accept a motion to approve those.
This is Judge Cowan. I'll make a motion to approve.
Judge Craig seconded.
We have a motion and a second. Is there any further discussion? Hearing none. All those in favor, please indicate by saying aye.
Aye.
And those opposed, likewise by saying no. Motion carries. Okay. As far as old business, we want to ask our board members if there's anything that the administration failed to adequately follow upon from our last meeting. Anybody know of any issues? Hearing none, then we'll move into our resource stewardship, and I'll call on Sean to talk to us there.
All right. Thank you, Judge. And thanks to Ron for always putting our financial report together. I know I give the report, but he does the hard work to put it together. Let me share my screen. So, of course, everyone was forwarded the packet in advance. And I know I sent a couple different revisions to the packet as we added more material. So I'll be showing everything tonight on the screen, but your last email should have the complete packet. So you should be seeing our financial statement. There's always a lot of documents in here, but in the cover letter, Ron has noted that I've put in looking at the next to bottom paragraph there, that there's about $375 that we owe in backdated Medicaid match payments. But even still, we're still projecting to end this year at about a $2.2 million surplus, which really is better. We were budgeting for a surplus, but that's significantly better than the surplus that we were budgeting at, and that's for a couple of different reasons. One is when we're doing traditional services and the traditional avenues of reimbursement, not all the employees are fully covered. But since most of us have been doing COVID things, and since we've been getting federal funding that's flowed down through the State Department for Public Health, it's pretty much covering our cost entirely. Plus, it's not quite as expensive on us running the COVID operation as it is running our regular program. So if there is any advantage to that, we're coming out a little bit better financially projections this year. On this page, you can see this is where we've budgeted for the year to date over on the right hand block. This is what we've actually earned up here under the earned revenues. And at any time, Ron, feel free to correct me if I say something wrong. We probably won't pull in all of our state revenue this fiscal year. And we probably won't pull in all of our service fees this year because we've been pulled out of our routine duties and into COVID. But you can see we've got substantially more federal money, and we've still got a good chunk of local tax money to collect. So we're doing pretty good there. Our expenses, several of the expense categories are less than what we budgeted because, again, the expenses are different because we've been mostly doing COVID. But also our salaries are up because we've had to hire a lot of temporary workers to help with contact tracing and case investigation. We're starting to scale back on some of our surplus temporary workers now that the cases are starting to slow down. These graphs just show what I've presented you, but in graphical form, where we're going. This is kind of a difficult year. I mean, it's good financially, but it's a little difficult in the fact that we haven't executed our budget as we planned because, everything turned upside down. The next sheet in the packet is the balance sheet, in case you prefer to see the report in a more traditional accounting format. The next sheet shows where we are at this point in time compared to last year. And you can see last year we were at this point in time $175,000 in the hole. And I think we ended last year at just over $1 million surplus. This year, right now, we're about 1.185 million surplus and looking at probably a 2 million, depending on how the federal and state government continues to fund us on our COVID response. This report shows where we are with our the amount of services we provide in clinic and lab and supplemental. You can see we haven't performed as many clinical services. Some of that's because there's a natural downward trend for demand of clinic services through the health department, but a lot of it's because we've displaced our traditional clinical services with more COVID services this year. So again, everything's going to be off some. This shows you a trend report by year of our services and how they've clinic and lab over time, and you can see our unduplicated patients and our clinical services have been going down each year as more of the private sector takes over some of the things that we traditionally have done. This report shows our revenues and our expenses, and it shows the cost centers where we're generating more than we're costing, and the ones where we're going under. Then it shows you that real numbers versus budget numbers, and shows you where we're under and over. And again, it's a real hard year for this to be very meaningful because everything is so much different than we planned when we submitted our initial budget. This cost center, this report shows what we've earned or billed versus what we've actually what we've been paid and what we've billed, and it shows the variance. So I like this report because it shows that we've got $618,000 in the pipeline. We won't collect all of that, but a good chunk of that we will end up eventually collecting. This shows by cost center our revenues and our expenses, and again, it also shows our flexible money is our general grant money and our local money, so we can kind of see how each cost center is performing before we spread our flexible money. That helps us for budgeting and planning to see which programs are standing more independently and which ones aren't. This report shows the calculation of our unrestricted reserve. And last year, when we closed FY20, we were over what we're allowed to have in unrestricted reserve. We have a total of 5.6 million unrestricted, and when you add in the restricted reserves, about 9.6 million. So we've got a good amount of reserves. I know that sounds like a lot of money, but you have to remember we owe about $70 million to the retirement system. So it's enough to make a pretty good down payment on what we're going to end up owing. We'll see what that amount is after this legislative session closes, and we'll figure out how the state's going to structure the repayment plan. But over the last few years, we've been ending at a surplus, so I'm hopeful that the surplus will be sufficient going forward to cover whatever obligation we have on the repayment or onto the retirement system, or the payment to the retirement system. And this report shows different allocations. Every year there's some categories where they take a little money and some categories where they add a little money. We add this into our budget report so that anything that's changed since you approved the budget, you can see the changes in up and down as far as our revenues. So you can see that there. But that's a pretty brief report. But the good news is we are projecting to end at a good surplus. Anybody have any questions about our financial report? As far as my director's comments, I just finished all 10 of the local health board meetings, and I spoke to each local health board about our COVID-19 response. I don't know that I need to go into detail. It's been a challenge in a lot of ways. As I said at the local meetings, we are experts in disease investigation, isolation, quarantine, enforcement of public health laws, public health messaging. we do all those things, but COVID-19, we've been at this about a year, and so it's lasted a long time, and it's been very intense, and it's been a challenge. And we've not only had to do case investigations and contact tracing, we've been pulled into trying to enforce, the governor's orders and recommendations, and some of that was controversial, so it put us in a controversial spot. However you look at it, whether you were for them or against them, we were in the middle of that. And now we're working on vaccinating, which is a challenge too, because we have less supply than demand. And we're trying to work our way through the 70 and older, and then the 60 and older. As far as vaccination efforts go, and of course, the health department hasn't done all of this. All of the nursing homes have had the opportunity to get a first and second dose, and I think a third visit from the federal program with CVS and Walgreens. All of the health staff that signed up initially to get vaccinated have had the opportunity to do that. First responders have, school staff have, and we're moving pretty rapidly through the 70 and older. In fact, we were scheduling appointments Monday. We had enough appointment slots left over at the end of the day that we opened scheduling back up again today, and we expanded to 60 and older. And we intend to stay at the 60 and older until we have trouble scheduling those appointments, and then we'll open up more broadly to the larger 1C group. We're focusing on the 60 and older because they represent about 91% of our deaths and about 75% of our hospitalizations. So we will have made a major public health impact when we work our way through that target market. So anyway, does anyone want to ask me anything about COVID or anything related to that? I know Dr. Phillips was asking me earlier about vaccine supply. I think we are getting about just over 5,000 doses a week into our district. Johnson & Johnson was just approved, and there's going to be a significant push of Johnson & Johnson vaccine. My understanding is that the governor is looking to use a lot of the private pharmacies for that. I don't know any more details than that. Generally, the governor announces that on Thursdays. So we'll see. But it's going pretty good for this to have been upon us for a year, for a vaccine to have been developed, and for us to have this much vaccination already completed. We're really doing pretty good. Even though if you're someone who wants the vaccine and haven't been able to get it yet, I'm sure it doesn't feel good. But it has ran pretty quick in according to the big picture. Anybody have any questions about anything?
Sean, staff for nursing homes, of course, I know you said everybody's had the opportunity for the first and second dose. Those folks that are not taking those, what's eventually going to happen there? That population in the nursing homes, those people are always going to be high risk as long as this stuff is around. I know a lot of people are probably saying, well, I don't want to take it right now. I want to see what happens and all that. What's eventually going to happen with those staff? Are they going to be forced to take that a little bit later on, or what's going to happen there?
I don't feel like anybody's going to force them. I don't think the legislature is going to pass a law to require that. And I don't think the governor is going to order that. What we're really shooting for, Judge, is the herd immunity. So not everyone in the population has to have the vaccine to reach a herd immunity. And
Right.
there's different projections of what the herd immunity is. 75, 80% of the population, 65%, but that's what we're aiming for. When you get enough of the population that has developed a natural resistance to a disease, it has trouble spreading. So, a few people will get it, of course, but it just doesn't turn into a major outbreak. It's more contained. So that's an administrator's description of that.
Okay,
So
well,
medical people might want to clarify.
That's fair enough. I understand your logic behind that. Another question, I guess all this surplus that we're looking at, I'm sure a lot of that is a direct result of how much CARES funding that we have received. will the federal government be asking for any of that back at any point? Or are we going to be able to show that all that went towards COVID? Or, I mean, are we just going to wind up in better shape because of COVID in a roundabout way, I guess?
Yeah, we're cost reimbursed, Judge. So we bill and then they fund us our costs afterwards.
Okay, very good. So a lot of it is just a direct result of less spending in other areas.
Yes, and staff that would have traditionally not had all of their costs covered have had the majority of their costs covered this year. Plus, like I said, it's not as expensive to run the COVID response. Yeah, as far as the supplemental things that we have to purchase compared to our traditional programs.
John?
Okay. Yes.
This is Dr. Miles. I've had a lot of the physicians, stating they're really getting pressure from patients who are wanting this. And as you know, there's just not enough vaccine to go around. But, I'm disappointed that it was all done through pharmacies and that sort of thing and not done through primary care physicians to be prescribed to their patients according to the guidelines. But even with that, I think we should make an effort to contact physicians and let them know, what's in the pipeline, what we're planning to do. I know there are one or two certain groups, and you and I have already discussed this, that are getting some of the vaccine to the exclusion of other groups of physicians. And I know they're going through the pharmacies, and I understand how politics works and at the federal level and the big pharmacy corporations, et cetera. But I think we really need to be reaching out to the primary care physicians and letting them know what our plans are, when things look like they're going to be available, give them an outline, because they're really being pressured by the patients. I mean, I'm not in practice. I'm still getting calls almost every day from somebody wanting to know where they could possibly get in to get it. And they're not in the level 1, level 2, even level 3 groups, and having explained to them, we just have to wait till it's available. But, and I know you have no control over that. And like I said, I understand federal politics, but at the same time, I think we need to kind of be reaching out to the physicians in our counties and letting them know, we're going to be having these clinics at this point in time. These groups will be available. And just a rough, it's going to be July till we have vaccine for everybody, unless this new vaccine moves along at huge quantities. So,
right. Let's see if I can get my screen shared.
I agree with those comments, Dr. Miles. Is it federal politics that's controlling this so much, Sean? I mean,
well, it's
from the
part
level?
of it's federally controlled and part of it's state controlled. The state's getting a push of vaccine that they can choose to do with what they will, and so part of it is state controlled and part of it's federal controlled.
I mean, my personal feelings is as localized as we can do this thing is the best.
Unfortunately,
whether it's health department or whether it's our hospitals and primary care physicians, like Dr. Miles said.
I want to show you all on our website, when you click that main COVID-19 banner, it takes you to our daily brief, which gives you all of our case information for the day. But at the bottom of the page, I try to keep this updated. It shows every provider in our district that's giving vaccine and how to schedule an appointment. So, and whether you text it or you schedule online or you call or whatever. So, and it also describes basically what phase we're in, and it shows the different phases, 1A, 1B, and 1C. You can click that and it'll give you a blown up version of it, and it gives you the definitions. So that's something that we post every day, and we'd be happy to share that information with anyone that wants to hear it. And I have, I don't personally, but the health department directors meet with Dr. Stack once a week, and I will continue to advocate for more of our area providers to be able to join the vaccination. So
I think we really need to do that. Just to be honest, when it's Walgreens and CVS as opposed to the primary care providers, that's a slap in the face, and it's also less equitable distribution. I think as a physician, I've got a 90-year-old patient. I've got a 70-year-old patient. I got a 65-year-old patient that's on rheumatologic medications. They're going to suppress their, I want to know who to give those vaccines to, as opposed to calling 151 times to try to get in to get a 92-year-old vaccinated. So I think it would have been done more equitably, but again, I understand how it works. But I just think if we can at least reach out and blast fax or email or whatever and just say, this is how it's going, and here's the numbers you can call, blah, blah, blah. But they're really the doctors are getting a lot of pressure. They're the ones that are calling me. They're getting a lot of pressure from the patients, and everybody's getting antsy to get this. So,
Yeah.
I agree with that. This is Patty Gwynn. And what I agree with is I get calls every day. Where can I get the vaccine? I have a pharmacy. I can't get it yet. It's just gone to the CVS and the Walgreens. And that's not right either.
Yeah. And of course, if you're a private pharmacy or a physician, you have to sign up through that state website to be a provider, to be on their list, to be considered to be a vaccine provider. So,
well, but some of these groups are part of hospital systems that are signed up, and they still can't get it.
Yeah.
Yes, that's what I'm doing. I'm signed up with a group, and I'm looking closer today, but because of the new vaccine coming out, but it's still not available to all pharmacies.
And I think also rural Kentucky, there was a big outblast here locally when somebody got on and said they went to Louisville, and it was a 35-year-old person. They went to Louisville and got their vaccine, and you got 90-year-old people waiting in line to get it down here. So
some of that's a little hard to gauge because the first push was to medical providers, first responders, and then school personnel, and they're of all ages. So, it's a little hard to tell who's supposed to be there and who may be sneaking through.
Yeah. And that's what's happening. And then people see that and they get upset. This person was none of the above. So,
yeah, well, I'm not saying somebody's
but they put it on Facebook that they got it. And so people get upset down here. And, I think the rural areas feel like they've been left out. And I know they have. I have contacts in West Virginia. It's the same situation there. It's going to the medical, the medical schools and the big pharmacies, and it's being distributed, and people in the rural areas aren't getting anything. So,
yeah, we're getting about 5,000 doses a week right now, the best I can tell. And I'm not sure, as a district, if that proportionally is the same amount each other district is getting. But that's what we're getting right now. I met with the county judges a few weeks ago about, our district, the health department, when we get our 1,000 doses a week, it comes to the district. So we can divvy it out to the counties the way we choose to. We're the only provider in the district that can do that. All the other providers get a dedicated weekly supply that stays, at the location where they're receiving it. So, what we do each week when we're setting up our scheduling for the next week, we try to look at each county and see how much supply are they getting, how much of it's being given, and we try to push more doses of our supply to the places where there's holes. So, we're doing our best to kind of balance things out with what's within our power.
I understand that you don't have control over that. So I'm just pointing out the politics of it.
All right. Any more questions for Sean? If not, why don't we move on then to our grants report? Carol is going to bring that to us.
Yeah. And by the way, I'm going to go ahead and mute everyone because we're getting a little bit of background noise. So when you want to talk, make sure you unmute. Carol, that will include you because I'm getting ready to mute everyone.
Okay. So our grant summary for this meeting, since our last meeting, we have applied for a grant. It's $799,000. It's a 4-year grant, and it would expand our Heart for Change project into additional counties. And also there's a focus on minority serving churches during the first 2 years of that 4-year grant. We have also, or are also in the process of applying for no-cost extensions. Due to COVID, we had to suspend a lot of our grant activities. And so we're going to be filing for no-cost extensions, which will allow us to resume the activities and expend the unspent grant funds after the grant period ends. So I think Melanie submitted one today, and then we're working on one for Heart for Change. So hopefully those will be approved and we will be able to resume and pick up where we left off. We have received approval on our revised ELC budget. We are now able to apply a portion of the build out and insurance cost of the mobile van unit to the grant, and the total funds reallocated to that project is $24,734.
What does the ELC stand for?
Melanie, can you help me with that one?
I think it's expanded lab capacity. It was originally for expanded testing opportunities. We were going to do mobile testing, and this has taken so long to roll out and get going that now it's going to be probably vaccination efforts, mobile vaccination efforts.
Yeah, so we didn't get the van in time to do expanded testing, but we will get it in time to do some targeted vaccinations. So that'll be good. And we'll have a mobile van for mobile clinics into the future. So that'll be nice. Was that everything, Carol?
Yes, for that portion, yes.
Okay.
All right, thank you, Carol. Next item then, we need to assign a budget review committee. And in the past, typically we just allow the executive committee to perform this function. So unless there's objection, we'll go ahead and ask for a motion to allow the executive committee to perform the budget or to comprise the budget review committee.
Yeah. Let me, before we take that vote, let me see here. Our executive committee is Judge Phelps as the past chair, Dr. Flosday as the at-large 1 of 3, Judge Kelly as the chair, Dr. Miles as the at-large 2 of 3, Judge Robertson as the at-large 3 of 3, and Dr. Gail Phillips as the vice chair. And also, Judge, I forgot to mention about Terry Lawson took Rosalie Wright's position on the district board from Macquarie. You might want to introduce him or have him introduce himself. I think I saw him in here a while ago.
Sorry about that. You mentioned that before the meeting started, and I forgot all about it. But yeah, Terry Lawson, if you'd like to unmute and if you'd like to say hello to the group and say a little bit about yourself, we'd like to welcome you to the group here.
Well, thank you very much. I practice as a nurse practitioner and as a physician's assistant, both. I'm duly certified in McCreary County, South Fork Medical Clinic, which is a rural health clinic. We also run Cumberland Family Clinic in Pine Knot, which is our sister clinic. We have a total of 5 practitioners between the 2 clinics. See approximately 125 patients a day, give or take, between the 2 clinics. And I've been chairman actually of our local health board now for, I don't know, maybe 10 years. I can't remember, but I've been involved with this board a long time ago, sat in on some meetings and some things like that. So it's not a totally new experience for me, but happy to serve and happy to be with everyone. And just one last thing, I would like to say that an agreement with the primary care physicians and the problem we're having as far as the vaccinations. My mother's 88 and I finally got her vaccine just last week. So, you know, it's a very typical story here as what everyone else has spoken to. So I'll leave it at that and just say again, glad to be on the board.
Yeah. One thing, I know, Judge, you're trying to appoint a budget review committee, but let me say this to all the board members. We opened up 1,000 appointment slots Monday and we didn't fill them all. So we went ahead and expanded to 60 and older. So guys, if you all know folks that are 60 and older that need an appointment, every Monday we schedule appointments. And I would encourage you to have them get that vaccine sooner rather than later if they can. Because if we can't fill our 60 and older slots, we'll go to full 1C. And when we go to full 1C, that's a lot of people. And then the 60 and older will be competing with the rest of the 1C group to get those appointment slots. So we want to stay in the 60 and older group until we work our way through that. But we need people filling those slots. So I'll just throw that out and y'all can pass that around. We do advertise on the radio and on social media. So, all right. I apologize, Judge. I sidetracked you when you was trying to
That's
appoint a
all right.
committee.
Well, thank you, Terry, for joining our board. Now, are we supposed to, looking at your name, we supposed to refer to you as Tank?
If you call me Terry, I would probably think you're my mother. She's the only person I know that calls me by that name. So yes, Tank, please.
All right, great. Well, it's good to have you aboard. So anyway, we were asking if there's no objections that we would just have a motion to name the executive committee as the budget review committee.
Judge Kelly, this is Mike Anderson. I make the motion.
I'll second it. This is Judge Cowan.
Okay. We have a motion and a second. And is there any further discussion? All in favor, please signify by saying aye.
Aye.
Any opposed likewise by saying nay? Okay, motion carries then. Thank you. And that'll take us to our next item on the agenda then would be continuous improvement projects. That back over to Sean to lead us through that, please.
All right. So one thing is, of course, we're not meeting live right now, so you can't make suggestions on the back of the agenda and turn them in. But you all have my email address, so if you ever have any suggestions, feel free to reach out to us. As far as the new employee orientation goes, I think that's Carol.
Yes. So with our new employee orientation, we are ready to move into the next phase, which will be the final phase. We've tested it and it seems to be working well. So once our COVID response has slowed down and we start hiring people in again, we will start doing orientation in their home counties instead of having them drive into Somerset. So hopefully that'll save some travel time for them and make things a little bit more efficient. And I think I've got the next one too, the Harassment Project.
Yes, go ahead. I'm sorry, I was muted.
I was on mute. I'm sorry. Yes, go ahead.
All right. So that one has been put on hold. We were working with some other HR. I was working with some other HR managers across the state. And when COVID hit, they were impacted a lot more so than I was with at that time, being that they were smaller health departments. They were being pulled in to work and do other things instead of just HR. So that's been put on hold and will resume once all of the counties that we were partnering with to do that have been freed up.
All right. So someone made the comment that their 66-year-old mother checked yesterday to try to sign up for the vaccine. We Monday we were restricted to 70 and older. Today, Tuesday, we went to 60 and older. So if she checked yesterday, we were still at 70 and over. We were intending to stay at 70 and older until, we had trouble filling those appointments. So, we realized Tuesday or today that we needed to expand on out to 60 and older. So that's why she had that experience. The Directorate and Board survey is next, Judge. I'm assuming you want me to just go through that whole section?
Yeah, they can do that. It'll be Janae, right?
Yes.
Yes, a copy of the survey results were included in your packet. This was a little survey that we done in January, and the results were very good. And I'd like to thank each of you that took a few moments to complete the survey, because we do value your input, and send us suggestions for improvement anytime. And if you have any questions about the survey, feel free to email me.
One thing I will add, I appreciate you all who rated me as the director, favorable or very favorable. There was one person that listed that they disagreed that I didn't keep you informed of key issues. I don't know who wrote that, but I mean, if you would reach out to me and let me know what you want to be informed about, I will try to keep you informed. I would also encourage any board member, reach out to some of the other health department in the state, to their board members, and compare how you're being informed with how other health boards are being informed. I believe we're one of the most transparent boards in the state, and
maybe they need to make sure that they give you their correct email. I get more emails from you than anybody.
Yeah, so I try to keep you all informed. So, but again, maybe there's something specific that this person was talking about when they made that rating, and I just don't know what that is. But if I knew, I would try to, as long as it's reasonable, I would try to do whatever you guys ask. And then thank you all for the positive comments.
All right. Well, is it all, Janae?
Yes, sorry.
We'll move on then and let Amanda give her annual Epi report.
Amanda, if you're talking, you're muted.
Okay, can you hear me now?
We hear you now.
Excellent, thank you. So what I'm presenting tonight is usually it's the annual reportable disease outbreak report, the annual Epi report, and this is given every fiscal year to let you know reportable diseases that we've seen in our district, numbers, as well as outbreaks that we have seen. Next slide. So when we talk about reportable diseases, it's important to remember that those that we report to you must meet the CDC lab or clinical criteria to be determined a case. Labs and reports that don't meet case definition, they are still investigated, and these still require time. They're just not included on the following report. So what's on the following report are only those that meet case definitions. And next slide, please. So this is the fiscal year from 2019 to 2020. And this is a little behind. Normally you all get this report in the September or December meeting, but due to COVID, we pushed this back to the March meeting. This is all included in your packet. So I know the screen is a little bit difficult to see, but this is the past fiscal year. You can see on the left side of the screen is the conditions, the reportable conditions. And then across the top, you see the counties. Going down, you can see the numbers of each reportable disease by county. And then over to the far right, you can see the total number of each disease. And just a little tidbit of information, you'll see we have 459 reportable diseases in the fiscal year, as opposed to we had 275 the year prior to that. So definitely more. And of course, we know that COVID is a large contributing factor to the increase. Okay, so for each year, I give you the top 3 reportable diseases with the highest case counts. This year, the top 3 was 2019 novel coronavirus, hepatitis A, and salmonella. Last year, our top 3 was CAMPy, hepatitis A, and salmonella. A common trend we see is salmonella is always in our top 3. And of course, this year, the novel coronavirus is new. We have never had that before. During, when we have outbreaks in our district, we have what's called a Epi Rapid Response Team. So for every outbreak that we get, we investigate, and that is done by a team, not just myself. So our medical director, myself, the regional epidemiologist, the nurse administrator, the local county health department nurse, and the local environmentalist. We go in, we usually do a site visit with the facility, and we follow the facility during their outbreak, and then after write a after action report of our findings. So the next slide, you'll see our outbreaks for that, for the fiscal year 2019 to 2020. So we had 10 outbreaks this past fiscal year, 1 salmonella, 4 influenza, and 5 norovirus. Where these outbreaks occurred, we had 1 in a skilled care facility, 1 in a restaurant, 1 in a faith-based facility / gathering, and 7 in long-term care facilities. We tend to see most of our outbreaks do occur in long-term care facilities, but this past year we had a few different outbreaks that we don't normally see, such as in a restaurant, in the faith-based facility, or gathering. So this chart shows you what county the outbreak occurred in on the left column. The next column tells you what type of outbreak it was. The next column shows you what location, and then the far right one shows you what date that occurred. You will see that we ranged from July to March, but it's very interesting that in March of 2020, that's when our last outbreak. Normally we tend to see our outbreaks occur on into June, but in 2020 we did not. But at the very bottom of the slide, you will notice that March 6th was when Kentucky identified their COVID-19 outbreak. This is a map that this was from February 28th. This is the U.S. COVID-19 average daily case count the last 7 days. Just shows you a representation, and you can see where Kentucky, we are the second to last blue. So we are still seeing a large daily case rate of COVID-19. Looking at Kentucky specifically, since March 6th of 2020, there have been 404,622 cases, and this is as of February 28th, and there has been 4,637 deaths in Kentucky. So looking at the statistics between Lake Cumberland and Kentucky, Lake Cumberland currently has a 5.5 hospitalization rate, and that has decreased from 6.41 at the December meeting. So this is good news. Kentucky has 4.73 hospitalization rate, which is lower than our district, but also Kentucky's rate has also decreased. Looking at mortality rate, Lake Cumberland is 1.77. That has increased from 1.54, and Kentucky is 1.14. So we are also higher in Lake Cumberland than the state when it comes to a mortality rate. This is the chart that we give you every board meeting to kind of let you see where we stand as a district when it comes to COVID-19. These numbers are as of February 28th, just showing you the left column, of course, is county. The next one is total active. We are currently total active cases at 366. That is down 640 from our last meeting in December. So this is good news. The total amount of active cases has went down. You'll see our recovered number, then deaths. We have had 358. We had an additional 229 COVID-19 related deaths since the December meeting. And then you'll see our total case count for our district to date is 20,273, which was an additional 11,876 in 3 months. And that is the end of my report. If anyone has any questions.
All right, well, thank you, Amanda. If no questions, then we will move on and to our partner engagement and let Tracy speak to us about our syringe exchange progress.
The only update that I have to share is that Dr. Miles presented virtually to the Burkesville Fiscal or City Council meeting a few months ago and they did vote unanimously to approve a syringe exchange program. So we're waiting to hear from Cumberland County Fiscal Court as far as whether they approve or not to move forward there.
Be honest with you, I'm not confident enough to put it on the agenda just yet. I've got a couple of well, not more than a couple, getting negative feedback from other counties, people coming from other counties, locals not using it. Of course, and then we also still got a lot of law enforcement and first responders that are opposed to it. So just kind of trying to feel everybody out. I know I felt a little more positive a while back. Of course, we got a new mayor, former mayor for city. Didn't want to talk about it at all. Of course, you got some new councilmen, but of course, our mix has changed as well. So I'm just kind of trying to feel it out. Not like I said, I'm not confident enough to put it on the agenda just yet, Tracy.
And as things move forward and we're allowed to do more presentations, Judge Phelps, we'd be glad to come in and do some of those across to the different sectors in the community.
Okay, thanks. I'll try to be in touch a little bit more about it.
Thank you.
Any other questions or comments for Tracy? If not, then we can move into our oversight section and let Carol come back and speak about the Human Resources report.
Okay. Since we last met, we've had 4 people come on duty. 2 of those were contract. One of those was a temporary worker. And one came back, she had left and came back as a merit employee. We've had 6 go off duty. All 6 of those were temporary contact tracers. As Mr. Crabtree mentioned earlier, now that COVID cases have started to decrease, we're starting to scale back on the amount of contact tracers that we have. So those 6 have gone off duty since the last time we met, and we have, I believe, 7 more expected to go off duty at the end of next week, and then 4 more going off duty the week following that. So we're starting to scale back. And I believe that's all I have.
Okay, thank you, Carol. Any questions for Carol? If not, then we'll move into policy development. We'll let Sean talk about, I guess he says there's no annual review of the policies this year. So do we need to move on past this agenda item?
We do usually do an annual report of our policies. It's just that the staff have been so tied up with their COVID-19 that we just haven't had time to go through that. So with your all's blessing, we will just postpone that maybe for a year. That'll be a violation of our policy and procedure. We do have a policy that says we will review them annually. But you know, we can only do so much, and we've been overwhelmed. So, and there wasn't any new policies this board meeting. So if it's all right with you, we'll push the annual policy review over.
Hearing no objections, we will let that go. So that brings us into our next meeting date. And I was looking at my calendar. Looks like June 1st would be the first Tuesday in June. Is that what we typically try to do?
Yeah, I think during the budget month, when we're approving the budget, we go a little later in the month just to give us more time to try to get any kinks with the budget worked out. Ron, when would you be comfortable as far as the budget meeting goes?
I think we always do it like around the 3rd week, Sean. So if it's possible, I think the June 23rd would cover it. Or I'm sorry, not June 23rd. June 22nd. I'm sorry.
That would be the 4th Tuesday. So you get the
Yes.
1st, the 8th, 15th, 22nd. So you're looking at the 22nd.
Yes, the later the better, just because if the executive committee approves it and the state never knows how long it's going to take for them to get out our budgets to even get started, just because of the allocations, how the retirement's changing and everything. We could also do the 15th if that doesn't work, but I prefer not to go before the 15th. I think that'd be pushing it.
Does anybody here object to the 22nd being our next district board meeting? Here, no objections. Let's plan on that to be 7 o'clock Eastern, 6 o'clock Central on Tuesday, June 22nd. Is that correct?
Yes, sir.
All right. All right. Well, you don't have anything else, do you, Sean?
No, sir.
Okay. Well, I've got a closing comment here, just an observation that I've made, and some of you physicians may be able to help me with this. But, I've noticed in the age of COVID here that we've not heard as much talk and outbreak with the flu, typical flu. And even I was looking into this, and even the swine flu and the bird flu. And I was doing some research and came across these treatments, and you'll tell me if I'm wrong, physicians. If you get the bird flu, you require a tweetment. And if you get the swine flu, you require ointment.
Very punny. Very
And
funny.
with that, we take a motion to adjourn.
After that, I definitely make that motion.
That was Dr. Miles.
I second.
All
That's,
right.
Dr. McKinley.
All in favor?
Aye.
Y'all have a wonderful evening.
Thank you
You
all
too.
for joining.
See ya.
Bye.